Okay, let me start the presentation. So topic of my presentation is the early preclinical diagnosis of transplant-induced cardiotoxicity among breast cancer patients in West Virginia. So as we all know, cardiotoxicity is a well-known pathological consequences in breast cancer patients, especially receiving Trastuzumab. So, and the current strategies for monitoring this cardiac dysfunction include serial echocardiography, and again, it's a highly expensive thing because we need to go to hospital every time for like serial echocardiography, and it's again an expensive method. So through this research work, we are planning to set a preclinical biomarkers which can be used as a marker for the early detection of this cardiotoxicity, so that we can detect that cardiac dysfunction before, like if there is any change in echocardiography or something, we can detect the change. So we have collected blood samples from breast cancer patients, like in three different stages, like a baseline, that means before the treatment of the chemotherapy, and 3 months, like 3 months after the chemotherapy, and 6 months after the chemotherapy. And we have compared these results with healthy control female patients. And we have analyzed some basic parameters, including echocardiography parameters. And we have found that the patients are not showing any significant difference in the echocardiography. That means even if they are having cardiac dysfunction, it's not showing in echocardiography. So we have collected some biomarkers and microRNAs, and we have tested the expression levels and whether they are going to be like varying with different stages of treatment. So we have analyzed different biomarkers such as troponin I, troponin T, cardiomyosin, then myosin light chain, platelet growth factor, something like that. And we saw a serial progression of increase in the patients which are having different stages of chemotherapy. That means the baseline patients, the values were really low, which was kind of comparable to like healthy individuals. When the treatment progresses, this cardiotoxicity markers are shooting up. Then we analyze some microRNAs with these biomarkers, like circulating biomarkers and microRNAs. They're all showing different, like they are having different important functions in cardiac function. So we shortlisted those microRNAs, and we did their expression levels, and we saw a significant increase when the treatment progressed to 6 months. That means they are showing fluctuation in response to chemotherapy. And these patients were, as I showed you, that echocardiography didn't show any changes, but these circulating biomarkers are showing significant change. That means we can see the change in the cardiac function or cardiac mode, like cardiac function or cardiac mechanism or anything related to cardiac tissue through these biomarkers earlier than echocardiography. And to conclude, or confirm our findings, we did a correlation analysis. Over there, we compared troponin T and troponin I. Basically, this cardiac troponin T and I are the important markers which is related to cardiac dysfunction. So we compared or correlated this biomarker, troponin T and I, with various biomarkers and other circulating biomarkers, and we checked whether there is any correlation between this cardiac dysfunction and this mRNA or other biomarkers level. And we got significant correlation between different parameters, and that shows there is a correlation that is connecting the progression of this chemotherapy with the cardiac dysfunction. So from this study, we are proposing a preclinical panel which can detect the early progression of this cardiac dysfunction, so that we can change the chemotherapy. We cannot stop the chemotherapy for sure because the patient is having breast cancer, but we can change the treatment modalities, or we can change the dose, so that the cardiac dysfunction cannot be like dangerous in future. So our findings present the translational applicability of the proposed biomarker in the early preclinical diagnosis of Trastuzumab-induced cardiotoxicity, allowing the management of cardiac dysfunction and improving the healthcare patient. And we did the study in West Virginia. West Virginia is kind of a economically low state when compared to other states in US. So in a state like West Virginia, this kind of biomarkers, like instead of the serial echocardiography will be very useful for the healthcare improvement of breast cancer patients. Thank you.